Hi everyone, my name is Julia Tang and I'm a physical therapist. I'm here today to talk about acute ankle sprains and what to do about them. So if you've ever played any sports or been active, then you've probably either had an ankle sprain or you've seen someone get an ankle sprain during your sport. And it usually happens if you're running on some uneven ground or you land on someone's foot or you get bumped and then your ankle, most often your foot rolls to the inside, which is an inversion ankle sprain. So it strains the ligaments and the tendons and muscles on the outside of your ankle and the outside of your calf or lower leg. So what we're going to talk about today is first, what do you do when you have an acute soft tissue injury? So that's soft tissue is muscle, tendon, or ligament. So it's not a bone injury, that's different. And then at the end of this video, I'm going to go over some basic exercises for what to do if you have an acute ankle sprain. So if you want to skip forward to those exercises, feel free, but otherwise we're going to talk about what to do if you have an acute soft tissue injury first. So this is kind of a new acronym. It's called Peace and Love, and it was brought to my attention during one of the podcasts that I follow daily from Institute of Clinical Excellence, or ICE Physio. They're a really great resource. They have free podcasts every weekday, so if you don't know about them, check them out. I really like listening to their podcasts. But anyway, they brought this acronym to my attention, Peace and Love. So it's a long one, but bear with me here. So the P stands for protect. You want to protect the injured area from going through any of those forces that originally injured it in the first place. So say that's your ankle, you can tape it, you can strap it, you can brace it, do whatever you have to do just to prevent that ankle from, for example, rolling inward again. The E stands for elevation. So this is just to try and get some of that swelling out. So you want to elevate, if it's your ankle, you want to elevate your foot and ankle above your heart level. So prop it up on a chair or on a couch just to try and move some of that swelling out. A is avoid anti-inflammatories. So this is it's actually recommended to avoid NSAIDs, which are things like naproxen, Aleve, Advil, ibuprofen. Those NSAIDs often don't help healing in the long term because they stop the inflammatory process, which is actually what helps your tissues heal, your soft tissues heal. And so along with that, you also want to avoid ice because that also it does the same thing. And that's kind of a controversial one because historically we usually ice everything that hurts, but this acronym actually suggests that you should avoid ice because it does the same thing as anti-inflammatories. It kind of stops that acute healing process, and we really want that to actually start going so that our tissues can heal. So the C is compression. So this is along with compression and elevation. Those are still the same from RICE. You want to compress and elevate the area, so you can use an ACE wrap or elastic bandage or like a sleeve or something. And that just also helps get the swelling out. And then the E in peace is for education. So we just really want to educate you about how your body knows best. And so your body's going to do a good job healing itself. So you just have to help that healing process go along. So you can do graded exercise. You want to know about this Peace and Love acronym, and then just let your body take care of the healing part. So for the love, this is also kind of going into the education part. You want to load the tissues optimally. So you don't want to stress out that ankle again. If you've already rolled it, you're not going to go rolling it again to load the tissues. But you can probably work out other parts of your lower leg, and then we're going to show you some exercises here to work some of those muscles gradually and appropriately. Optimism, you just have to believe that it's going to get better. So a good attitude will help your tissues heal. And sometimes we just say, oh, just ignore it and it'll go away. And that's actually this acronym suggests that actually might be like, if you believe that it's going to get better, it might actually help it get better. The V is for vascularization. So you want to get blood flow. Blood flow is good for healing. So you want to do any non-painful cardio. So for example, if it's an ankle sprain, you might want to get on the bike or like a fan bike, spin bike. You probably don't want to run on it right away if that's painful, but maybe you could swim or do some kind of non-painful cardio, maybe rowing or something like that. But just get the blood flowing in your whole body, and that will help the healing process. And then the last E in love is exercise. So we want to do appropriate exercise to regain all the strength of those muscles, tendons, ligaments that were injured, and really just get you back in the game. So with that, we're going to go over the basic exercises to do when you first had an ankle sprain. So one of the most common things that happen when you have an ankle sprain is, especially if you've been either put in a boot or you've been taping it or bracing it and kind of keeping it pretty still to protect it for a while, you often lose some ankle mobility, and most often it's this dorsiflexion, or pulling your toes up like your foot off the gas pedal. That's one of the directions of mobility that tends to be very limited after an ankle sprain. So one way to test is if you put your foot away from a wall, about one of your own hand widths away from the wall, you should be able to keep your heel down on the ground and touch your knee to the wall, or as I'm using here, an ottoman. So oftentimes after an ankle sprain, you might back your foot up and then it'll look like it doesn't really go. So the test is actually the treatment. Just keep your heel down. You can use your hand here to block your foot if you want to, or you can just lean forward and just drive your knee forward as far as you can over those toes. So this is ankle dorsiflexion mobilization. There's a few ways you can do this. You can do it kneeling like that. Put a pillow under your knee if that's uncomfortable. If you're at work, you can also put your foot up on your chair and do it elevated, and you can also put rest your elbows to get a little overpressure here. Or you can also just do it standing. You don't even need a wall, but you just put the injured leg in front, keep your heel down, and just try and drive your knee forward over your toes. And you can also go in all different directions. You can go straight forward, you can drive a little to the inside, a little to the outside. You might find one direction that's more limited than the others, so you can just focus on that direction. So this one, you want to do in a non-painful range, and pretty much as you can throughout the day, just to regain or maintain that mobility. So usually I recommend doing like 15 to 30 reps, like a lot of repetitions. You can do these up to every hour after you've had an ankle sprain, pretty much as often as possible, just to try to regain that motion. So now we're going to come down to the ground, and we'll do some strengthening exercises for those ankle muscles. Okay, so for these exercises, you need a little bit of equipment. All you need is a resistance band, and I've basically just tied it around my couch here. You can tie it around a table leg, chair leg, something heavy. So we're going to start with ankle dorsiflexion, or pulling your toes up towards your knee. So you can prop your heel up on like a foam roll or a towel roll if you would like to, but otherwise just rest your heel on the ground. The band is going to be anchored in front of you, and you're just going to pull your toes towards your knee, and you want to keep your knee nice and still here. And we're going to go ankle band exercises 4 different ways. So I usually recommend starting out with about 1 or 2 sets of 10, however much you can tolerate, once or twice a day. And then you really want to work your way up to be able to do like 2 or 3 sets of 20 multiple times per day, just to get the muscles moving. Again, we want to get blood flow into that area, and also just work all the muscles around the ankle. And this one can also help you work into that dorsiflexion mobility that we just worked on with the dorsiflexion mobilization. So that's ankle dorsiflexion with the band. The next one is, you can either hold the band or leave it tied around the couch. I just leave it tied for convenience. We're going to do plantar flexion. So you basically want to be pushing straight down on the band here. And so fix it so that it's caught around the ball of your foot, and then push down. And this one, it's usually helpful to have your calf propped up so you're not scraping your heel on the ground. And this one, if you can pull directly on it, you might get a nice straight pull here. But again, you want to do 2 sets of 10, 1 or 2 sets of 10 to start, then work your way up to 20 or 30 reps each direction, at least once a day. So that's ankle plantar flexion, resisted with the band. The next one is going to be ankle eversion, resisted with the band. So back up. And this one, we want the band anchored straight to the side. You can also put it around your other leg and just move your foot out to the side. So for here, you're just moving your foot to the side directly against the resistance of the band. And important, you want to keep your knee stable, so you don't want to move your whole leg to move the band. So stabilize the knee, stabilize the shin, and it's just your foot moving out to the side. So since these muscles are often strained during an inversion ankle sprain, because your foot goes that way, this one might be a little tender, a little hard, so you can use less resistance, or you can start out without the band if that's really painful. So the last one is going to be ankle inversion. So we're going to move so the band is directly outside, to the outside of your foot over there, and then you're going to pull in on the band. Again, same thing, stabilize the shin, don't let your whole leg roll in here. So you're just going to pull in with that foot. So the inversion one is often kind of a hard one to set up because you need the band anchored out to the side. So I'm going to show you some options to do if you're sitting at your desk or sitting at a chair that make these band exercises a little bit more easy to set up. Okay, so these are your options for if you're sitting at your desk. It makes it a little easier to set up. So you just stick the band around your chair leg. This can be a rolly chair, it can be a dining room chair. This is just what I have up here. So you can have the band anchored to the outside of your foot and then pull in. This usually makes it easier for people to do this exercise while sitting at their desk during work. So it's easy to get it done a few times throughout the day. So that's the inversion, pulling in. You basically just pivot on your heel. And you can do this in shoes too. You just put the band on the inside of your shoe. Just make sure your knee is stable. And then just pull inwards on the band. And then for eversion, you just shift your foot out the other way. Kind of sit sideways on your chair. Again, keeping the knee stable. And you're just gonna rotate out and control back in. So for all these, you wanna make sure you control back in. Don't just let it snap back. And you might notice like a little shakiness on the way back, and that's just your muscles learning how to coordinate themselves. So these are just the versions you can do seated on a chair. You can also do dorsiflexion. It's a little harder, but if you put your heel up on the chair, you can then pull up on the band. And then for the plantar flexion, you would just take the band off, hold it, and then push down like you're pushing down on a gas pedal. So those are the seated exercises of the banded ankle exercises. And that's it. So hopefully those ankle exercises are helpful for you if you sprain your ankle. So these are just the basic ones. And then as you get better and less painful, as it gets better and less painful, then you can progress to more advanced exercises like single leg exercises and get back to hopping, jumping, running, and then back to your sport. All right, thanks for watching. See you next time.